Hello, my name is Dr. George Vergu from AdoptionDoctors.com. And today I'm going to speak to you about immunization records from children born internationally in orphanages. Can they be relied upon? Can the immunization records from orphanage be relied upon? A very, 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 very common question that I often get from parents. In the time that immunizations with the anti-vaccination movement, a lot of parents are a little bit apprehensive about restarting the immunization on their children, especially the older child. Unfortunately, the easiest way and the most accurate way to update an internationally adopted child's immune status is just to basically start everything from the beginning. This process, unfortunately, does not sit well with many parents, and each case definitely needs to be evaluated on an individual basis. The decision to revaccinate the children from the very beginning as if they had nothing is something that needs to be made between the physician and the parent. Now, the reasons why physicians in the U.S. do not believe or do not want to accept immunization records from overseas, from orphanages, the reason is multifold. The medical records we get are basically inadequate. Sometimes the medical records are fictitious, there's poor documentation. Children sometimes are placed into many different locations before they ultimately get adopted, and the medical records may not always travel with these children. Sometimes the children, when they receive the immunizations, are a little bit immunocompromised, basically a poor immune response. And how can we expect these children to mount an immune response if they're not feeling well? And a very, very important topic is poor immunization management, vaccine management. The methodology to manage vaccines is very, very complicated, from storage to transportation to management in a refrigerator under cold storage. And sometimes it is believed that these practices are not followed. Now, children that live in orphanages, it is a well-known fact that they do have a little bit of a weak immune status. How can we expect an immune response from a vaccine on a child that is a little bit sick? Now, the reason that these children have a weakened immune status is because they're sometimes malnourished, sometimes there's chronic medical conditions that these children have, poor living conditions, sometimes there's poor medications to treat even the simplest of infections or disease, and sometimes we have the sequence or the timing between the vaccines and their boosters may not be given appropriately. Now, other reasons why the physicians in the U.S. do not want to always accept, right out of the gate, the immunization records is most importantly because of the fictitious immunization practices that can exist. Sometimes the vaccines are outdated, but if a child is living in an orphanage that has outdated vaccines, it's better to give them an outdated vaccine that may be inactive rather than giving them nothing. That's the mindset. The poorly stored and inappropriately handled vaccinations are a big topic of discussion. The biologically impotent vaccinations from poor manufacturing and storage can cause problems. The lack of the cold storage making them ineffective, that's the most important reason. In the United States, we have very rigorous methods of managing vaccine inventory. We manage the temperature of the refrigerators. We make sure that the vaccines are stored at an appropriate temperature as per the manufacturer. Physicians often have backup generators in case of blackouts. If you think about it, they have the vaccines in an orphanage in the middle of nowhere. They have a blackout for days. Now, those vaccines are going to spoil. So, because of all these question marks, sometimes we do not want to accept these vaccines. As I mentioned, expired vaccines are an issue, and the schedule and the sequence in between vaccines. Now, my approach to vaccinations, if the parents are agreeable, I often just am of the mindset we can start from the beginning. But if they don't want to, that's the sure method of making sure that the child gets the updated immunizations that are needed in the United States. If they're not okay with that, then I will draw serological studies to see if the child actually mounted an immune response to the vaccination, and if they did, then and the vaccine records are pretty good, then I'll just continue with the vaccines from there. In a limited number of cases, will I continue with the vaccine schedule as is. In order to accept the vaccines and continues as is, a couple of factors need to come into play, and is very strict. The child's growth and health parameters need to be perfect, meaning that they have to be growing well. The vaccine records need to appear valid with dates and manufacturers. There has to be absolutely no suspicion of foul play. All the blood work that we perform on these children have to be normal. And if the parents agree with this program, then we can accept. The revaccination controversy with children that are born internationally does indeed exist. This happens because the somewhat over publicity that we find on the internet. All I know, however, is that vaccines in today's day and age prevent deadly childhood illnesses that many young doctors today have never seen in their careers. And if you think about it, back in the day of the great-great-grandparents, many people had many children because they knew that children would expire by the time they enter kindergarten and first grade of preventable childhood illnesses. That just doesn't exist anymore. And the reason is it's because of vaccinations. So I am a big believer in vaccinations and how important they are in preventing communicable disease in children. Personal vaccine stories, there are many on the internet where people say they received the vaccine and they had the next reaction. Today's technology, the vaccines are very sophisticated. Back in the day, in my earlier part of my career, I used to get called all the time with adverse effects from vaccinations, fevers, fussy, cranky, swelling. The new technology of vaccine is so sophisticated that almost nobody ever calls anymore. People that had suspicions of vaccinations causing side effects, those tend to be a little bit louder on the internet than the many masses that get the vaccines and nothing happens. I don't force my beliefs on families they must get the vaccines, but I do try to educate them and tell them the importance of the vaccines. The good thing with vaccines and people in general in the United States is that good general health is pretty okay in the United States because most of the people around us are vaccinated already. But as we know now with the coronavirus pandemic and all, when nobody's immunized against the virus, many people tend to get ill, and that's the reason for the pandemic. And many people that are immunocompromised with chronic health conditions, advanced age, people that are immunocompromised because of chemotherapy or other problems, they tend to succumb to these viral illnesses. So while we are trying to vaccinate people to help keep them healthy, we are also trying to prevent these illnesses and having the people that are less healthy to succumb to these illnesses. Now, some final thoughts on immunizations and vaccinations. Because of the universal vaccination policies in the United States, children no longer really die unexpectedly of preventable childhood illnesses. And that's a good thing. Measles, varicella, meningitis, sepsis, we just don't see these things really anymore. Every couple of years, because of little pockets of areas where people are not immunized, we do see a resurgence of the diseases, and that's what makes for the news. But overall, most people are immunized, and that's a good thing. But for those that live in orphanages, they are still susceptible to these childhood illnesses, and it is very sad. And some of these childhood illnesses are polio, pertussis, meningitis, whooping cough, many others. So my final thoughts on the immunizations are that vaccines are good. You should really try to keep your child up to date as best as possible with the immunizations. When they come from overseas, either restart the vaccines from the beginning or obtain serological studies to see where the child stands and continue with the vaccine schedule from there. But I believe vaccines are very important. My name is Dr. George Rogu from AdoptionDoctors.com, the go-to place for international and domestic adoption, medical education, and consulting services. If you ever need medical records evaluated for an adoptive child, feel free to reach out to us.